Today we're going to discuss management of the older adult patient. It's important to understand the difference between caring for our older elderly population as nurses, one, because we have a growing aging population, and two, there's a few different aspects we have to think about when we provide our nursing care. Some physiological changes that are associated with aging. So cardiovascular system will have a decreased cardiac output and arterial stiffening. So this can lead to congestive heart failure, high blood pressure. Respiratory, we have reduced lung elasticity and gas exchange. Renal, we have a decline in glomerular filtration rate, which means our kidneys are not functioning as well as they could be, and this is a normal process of aging. So as we age, our kidneys are going to slowly decline. Musculoskeletal, we have a loss of bone density as well as a loss of muscle mass. Neurologically, we have slower reflexes, cognitive changes, memory issues. Skin will have decreased elasticity and thinner skin. Some psychosocial aspect of aging we need to take into account as nurses for our older adult population include loss and grief. And when we speak of loss and grief, this is not just regarding people that we know and love, like our spouse and friends, but also as we age, we can lose that independence that we've been so used to. So that also can be an aspect of loss and grief. They may experience increased depression and anxiety. They may have social isolation. If they don't have any family around to care for them or help them, and they're not able to get up and go out and about, they're socially isolated in their home. As well as cognitive impairments. This can include memory issues, dementia, delirium, Alzheimer's. Some common health issues in the older adult includes chronic diseases such as hypertension, diabetes, arthritis. They also can have polypharmacy, so multiple medications that a patient, especially older adults, may be on. And with this, we know we have a lower filtration rate in our kidneys. Everything kind of slows down, so it puts a bigger risk for drug interactions as well as overdoses and fall risk and things like that. Falls and mobility challenges, sensory impairment, so vision issues, loss of hearing, and then nutritional deficiencies, which we'll talk a little bit more about later. So polypharmacy is essentially just the use of multiple medications. So the risk we see with this is drug interactions and adverse effects. The more meds you are on, the more likely you are to have some adverse effects and interactions. So ways that we can help improve the risk is having regular medication review, patient education, and simplifying medication regimens when we are able to. Another aspect of medications that you need to be familiar with is the Beers criteria. This is essentially a guideline that's been developed to identify potentially inappropriate medications for older adults. So these are medications that are going to have higher risks than benefits in older adults. They require dose adjustments due to age-related changes in metabolism, and there are alternatives to commonly prescribed high-risk medications provided in the Beers criteria. Nutrition in the older adult. So we can see very often in older adults we have a malnutrition and dehydration issue. And this can be from altered taste, swallowing difficulties. They don't have that drive to want to drink water. They forget to drink water. Nutritional needs, they do need higher protein, calcium, and vitamin D intake. And some interventions we can provide is small frequent meals, supplements such as Ensure, And then assessing swallowing to ensure if they need any type of dietary modification, such as thickened liquids, chopped foods, mechanical soft foods, in order for them to get the nutritional needs they need to meet in a day. Fall risk and preventing falls. So falls can be caused by many different reasons in the older adult. This can be from medication, balance issues, and then environmental hazards. So some interventions we can educate them on is ensure proper lighting in the home, remove tripping hazards such as rugs, cords, miscellaneous items that could be in the floor, encourage use of assistive devices if needed, so walkers or a cane, and then of course balance and strength training exercises. In the hospital, you will often see a Morse fall risk scale. So essentially, this is where you assess your patient every shift to see if they are a fall risk. So you can see on the side, I've put a picture here. The higher the score, the more risk that they are. You're assessing if they've had any recent falls, multiple diagnoses when they were admitted, if they have to use an ambulatory aid, if they have an IV, if they're weak, if they need gait transferred, and then if they're confused and not oriented to their own abilities and think that they're stronger than they really are. And then our nursing role in preventing falls is providing education on all of these. So screening the potential fall risk with the Morse fall scale, and then educating your patient and caregiver on how to prevent falls not only in the hospital, but in the home. So in the hospital, you want to make sure they know, here's your call light, make sure the call light's in reach, your bed's in the lowest position, your 2 side rails are up, and they know to call for help if they need to ambulate to the restroom. So end-of-life care, this includes palliative and hospice care. So the two are different. Hospice care focuses on providing comfort and support for patients with a terminal diagnosis and prognosis of 6 months or less to live. It emphasizes quality of life and symptom management rather than a curative treatment. Then you have palliative care, which provides relief from symptoms and stress of serious illnesses at any stage of the disease, along with curative treatments. It aims to improve quality of life for patients and families. So our key differences is hospice is for end of life, while palliative can be provided in any stage of an illness. Another important aspect to talk to your patients about would be advance directives. So an advance directive is any legal document that's going to outline the patient's wishes for medical care if they become unable to make decisions themselves. As a nurse, I've talked to patients about this, and as a nurse practitioner, I kind of stress the importance of having an advance directive that includes your living will and durable power of attorney for health care. Living will is going to specify medical treatments that you do or do not want. So if you want to be intubated, you don't want to be intubated. If you want feeding tubes, your durable power of attorney for healthcare is going to designate a person to make medical decisions on your behalf if you're not able to. And these are important because it's going to ensure patients' autonomy and respect for their wishes. And it reduces stress on family members during critical situations, and encourages early conversations about care and preferences for the older adult at the end of life stage. Interdisciplinary care of older adults. So this is a team approach. It's going to be where we have a collaboration of physical therapists, dietitians, pharmacists, social workers, doctors, nurses, and also stresses the importance of family involvement in the care of a patient. So a case scenario of interdisciplinary care. So we have an 80-year-old patient with a history of stroke, diabetes, and now has limited mobility. Our team contributions will include a physical therapist that will design an exercise program to improve strength and mobility, dietitian to create a diabetes-friendly diet plan to address nutritional needs and prevent malnutrition. Pharmacists will review medications to avoid polypharmacy and manage diabetes. Social worker will coordinate resources like home health services and caregiver support. A nurse provides patient education on medications, diets, and fall prevention while ensuring continuity of care. So key points and takeaways from this chapter. Older adults require holistic care that considers physical, psychological, and social aspects. Nurses will play a pivotal role in managing the unique challenges of this population, and continual education and advocacy are essential for high-quality care. And as always, remember to review your vocabulary at the beginning of each chapter so you're familiar with it when it comes to testing purposes.